In Olivia's opening statement, she addressed the issue of the effects of birth control pills on the minor's body. She stated that birth control affects each woman's body differently. For example, it can cause weight gain or loss, nausea, irregular bleeding or changes in cycle, higher blood pressure, migraines, gallbladder disease, decreased bone density, and yeast overgrowth and infection. This is true, but I am not suggesting that minors have the opportunity to buy any form of birth control if they choose, without some form of consultation. Rather than schedule a doctor's appointment, a series of questions could be asked by the pharmacist. For example, they could ask if they're suffering from any previous medical diseases, or if they smoke. The State of Health states that under protocol developed by the State Board of Pharmacy, pharmacists first have to be trained to do a short consultation with the customer and select the appropriate birth control option. This would do away with the requirement of a prescription, while also keeping women safe. The pharmacist would not only ask a series of questions to determine the proper birth control for the minor, but also inform them of the possible side effects of it, such as nausea, headaches, weight gain, and mood changes. The consultant will also inform them that birth control does not prevent against STDs, such as gonorrhea and chlamydia, which are common in minors. This would mean that condoms are still necessary to protect them. The State of Health stated that students in pharmacy programs are receiving training in their classes in order to perform the consultation. This could be easily incorporated into every pharmaceutical program across the country. Medical conditions which increase serious risks with the pill are rare among minors. This means that the birth control the minor takes has a very low chance of causing serious medical risks. In many ways, birth control is known to protect against serious risks. The University of Maryland found that birth control can actually protect against ovarian and endometrial cancer. It was also found that oral contraceptives can also prevent iron deficiency anemia caused by heavy bleeding, reduce pelvic pain caused by endometriosis. Endometriosis is when the uterus lining is found outside of the uterus, and reduce symptoms of premenstrual dysphoric disorder, which is a disorder that causes extreme mood changes. Like Olivia Cornwell said, since minors do not have access to birth control without a prescription, then they have a serious risk of becoming pregnant, which itself has many medical and emotional consequences. Minors have more complications in their pregnancies, such that to keep the pregnancy and baby healthy, the teen needs to take good care of herself with a good physician, such as babies being born to teens who have a low birth weight, which comes with complications such as being born with the organs outside of the body. To keep the pregnancy and baby healthy, the teen would have to take good care of herself with a good physician. But if she doesn't tell her parents, then how can she afford it? If the teen has an abortion, there are a whole other set of issues. There's psychological pain, there's physical risks, and there's emotional risks. For the physical risks, she is twice as likely to experience cervical lacerations during and after abortion, and she's at higher risk for post-abortion infections, such as pelvic inflammatory disease. An abortion can also make teens at a greater rate or at a greater risk for infertility. Because teens are more likely to abort their first pregnancy, they face other complications as well, such as 30 to 50% increased risk of breast cancer. As many as 529,000 women die each year from complications of pregnancy and childbirth. It is the leading cause of death of women between the ages of 15 through 19. The emotional consequences is that if a teen cannot properly raise her child, the child could suffer, and this could be a great pain on the mother. There are also other risks to teen moms, like they face high levels of stress, which can lead to mental health concerns. They are also not able to complete their education due to the child. This does not even discuss the child's risks. If the mother decides to keep the child, then she might neglect it or abuse it emotionally or physically.
Okay, my rebuttal. I have 3 attacks. Number 1. The various effects of birth control is different for every girl. And yes, it can be dangerous if misused, as if any other medication was misused. In Olivia's opening statements, she gave a list of side effects that have been linked to birth control. The symptoms included weight gain or loss, nausea, high blood pressure, migraines, gallbladder disease, decreased bone density, yeast overgrowth and infection, increased risk for blood clotting, increased risk for cervical and breast cancers, increased risk for heart attack and stroke, and a few others. However, these symptoms are only a possibility. Not every birth control user experiences these side effects. But if a teen girl were to get pregnant, it would have a harsher effect on her body and have many more dangerous possibilities than the possible side effects of the birth control pill. Would a girl rather have the possibility of being affected by the birth control pill or deal with the definite consequences of pregnancy, birth, or abortion? Along with Heather's other opening points, she stated that 41% of U.S. high school students have had sexual intercourse, and nearly half of these students did not use any form of contraceptive. If these students had access to a contraceptive as easy to use as the birth control pill, why would we stand in the way of that? Us standing in the way could potentially cause more pain, emotional stress, than if they did have access to birth control without parental consent or prescription. Number 2. Olivia mentioned that birth control could negatively mix with other medications or hobbies, but any medication mixed with other hobbies and other medications could have a negative reaction. To point out one hobby she mentioned specifically, she mentioned smoking. To begin with, it is illegal for minors to smoke at all. If a teen had a negative reaction to the birth control pill because of being a smoker, this would be her individual fault. This is just the irresponsibility of some teens, and punishing all teens would not be justifiable. Although I do believe that if a teen is mature enough to have sexual relations, then they should be mature enough to go to their parents or guardians about their sexual relations. But with or without parental permission, smoking is illegal to all minors, making circumstances like these of individual fault and not teenagers as a whole. This is punishing a group for an individual mistake. Number 3. As Heather stated, pharmacists are now being taught to interview the recipient in order to find the best version of medication suited individually for her. Olivia said that without a professional's opinion, a woman cannot get the best for her body. Once again, being on birth control could help prevent even more stress and pain that could potentially be on her body because of getting pregnant from not having access to birth control. But back to the point, a pharmacist that is trained to help a woman get the best birth control pill option for her is considered a professional. If the birth control pill was available to minors without a prescription, and a pharmacist who is a trained professional helped guide her to the right pill for her, then there's nothing keeping her from using it. Her statement was contradictory. A pharmacist who could help her get it is a professional, making her comment invalid. Thank you.
I will first begin my rebuttal by addressing Heather's point. Her first point was the Center of Disease Control and Prevention found in a 2015 study that 41% of U.S. high school students have sexual intercourse. And of those, nearly half of them did not use any form of contraceptives. I feel that if teens think that they are both emotionally and physically mature enough to have sexual intercourse, then they should both be emotionally and physically mature enough to face the consequences of having sexual intercourse. Some of these consequences will include talking to their guardian about birth control and its side effects, which can both be long-term and short-term. Her second point was birth control differs from any other prescription-only medicine. It is not addictive. Now that is true. Birth control is not addictive. But like other prescription medicines, there are still dangerous long-term and short-term side effects. Some short-term side effects can include changing a girl's cycle, blood clotting, and ovarian cyst, and a list of other terms that I mentioned in my opening statement. An example of a long-term side effect includes infertility. Almost any form of birth control can cause infertility, like I stated in my opening statement. So, in addition to the physical toll of being infertile, a woman then has to deal with the emotional toll of not being able to reproduce. Her last point was the Daily Wildcat concluded that teens are more likely to take the birth control pill regularly than they are to use condoms, because condoms are influenced by sexual and emotional pressures. Condoms are the only form of birth control that protect against sexually transmitted diseases, or STDs. So, the sex education should stress the importance of using one. Teenagers that have sexual intercourse should be mature enough to know the consequences, and they should then try to protect themselves against said consequences the best they can. For Olivia's opening statement, she gave several statistics given about teen pregnancies from the ACLUC. She then said teenage pregnancies have more complications and there are major emotional consequences. I believe that birth control works differently for everyone. So there is a possibility that the contraceptive pill won't work it's not the best option for someone. The pills could potentially do more harm than good. If a teen wants to protect against accidental pregnancies and the consequences that accidental pregnancies can lead to, they would try to find the best option for them. Going back to what I said for Heather, if a teen feels that they are both physically and emotionally ready to have sex, they should be mature enough to speak to their guardian about birth control. Thank you.
In conclusion, birth control is a better way to protect minors from accidental pregnancies, so it should not require a prescription. It's true that birth control affects every woman's body differently, but it also benefits it in many ways. This is why it should be available to minors. It protects them from much more than pregnancies. Birth control helps protect against the peer pressure of going without a condom, along with the newest growing trend of stealthing. Another great thing about birth control is that a minor can take it even if they are not planning on participating in a sexual act. This keeps them always readily prepared for situations such as rape or stealthing. Birth control has a number of health benefits, such as preventing ovarian cancer and premenstrual endometriosis disorder. Birth control does affect every woman's body differently and can become potentially dangerous if a woman does not receive some form of consultation to help her decision. The State of Health proposes that pharmacists would receive training in their classes to perform this consultation. The pharmacist would simply ask a series of questions to determine the proper birth control for the minor. This task would eliminate the need for a prescription, while also keeping a professional opinion that protects the woman. The consultation not only makes it safer for minors, but it also makes it cheaper for them. They do not have to worry about the cost of the hospital bill just to receive the prescription. There are so many benefits to minors having access to birth control. It can reduce the number of accidental pregnancies in America. While it has been decreasing, it could be drastically lowered if birth control did not need a prescription. It would also decrease the number of abortions in the United States. It would be smarter for Americans if birth control was available to minors. That is why minors should have access to birth control without a prescription. Thank you for listening.
To begin my closing statement, I'm going to summarize my opening statement points. I begin by giving statistics and facts about the dangers that teens face and how many teens get pregnant each year. I said that 4 out of 10 girls get pregnant at least once before they turn 20. My second point was how teenage pregnancies have many more complications than a pregnancy of an adult would. This includes babies having low birth weight, the pregnancy and baby health from not seeing a physician, and the psychological, physical, and emotional risks of abortions if the teen did not have access to birth control and indeed got pregnant. The psychological risks, to be summarized, was about depression, the troubled relationships, the counseling and guidance regarding that abortion that would be needed, and how nearly 3 times they're more likely to be admitted to mental health hospitals than women in general. The physical risks I stated were they're twice as likely to experience cervical lacerations during the abortion, and they're at higher risk for infections. My third point was about the emotional consequences if the teen did have the baby. The challenges the baby would face growing up and the challenges the teen would face moving on from that moment in her life. My overall statement is that I believe it's a simple case of good outweighing the bad. Teens will do what they want to do with or without access to the birth control pill and with or without parental consent. Giving them access just helps them to do this safely. Teen pregnancy percentages could do no harm if they went down. In fact, it would help. Teens having access to birth control would indirectly lead to less children being put into the foster care system, less abortion, and less teen or newborn death because of the complications. My stand still remains that allowing minors to receive birth control over the counter without a prescription would help secure their safety when it comes to these specific situations. I believe that it would be in the best interest of teens all over the United States for the birth control pill to become available without a prescription and without parental consent. Thank you.
In conclusion, birth control should require a prescription for minors. In my opening statement, I had 3 points of evidence. The first being, birth control has dangerous side effects, and without a professional's judgment, birth control could be dangerous for that minor. My second point was, there are certain conditions, like diseases a woman could have, for example, liver disease or heart disease or diabetes, and certain hobbies that a woman could participate in, such as smoking, could potentially make the birth control even more dangerous. My third point was birth control differs for everyone. An IUD might work for one person, but the contraceptive pill might work for another. Without a professional's opinion, a woman would not know what is the best option for her. In my rebuttal for Heather, I stated that if teens think that they are both physically and emotionally mature enough to have sexual intercourse, then they should be prepared to face the consequences of having sex, which can include talking to their guardian about birth control. And for my rebuttal for her second point stated that birth control is not addictive, but it still has dangerous long-term and short-term side effects. My rebuttal for her third point was condoms are the only form of birth control that protect against STDs. So, teens should think more carefully about using one during sexual intercourse. Going back to my first, my rebuttal for her first point was that if teens are mature enough to have sex, they are mature enough to think of the consequences and protect themselves against those said consequences as best as they can. My rebuttal for Olivia was birth control works differently for every female. So if a teen wanted the best protection possible, she would not be afraid to speak to her guardian about birth control. Contraceptive pills could not be the option for one girl. It could be the option for another, but not for another. And could potentially do more harm than good. For my call to action, birth control can be dangerous. And without proper knowledge, it can be even more dangerous. So it should require prescription.